Alberta officials are calling for an inquiry following the death of a man at an Edmonton emergency department. The review comes as doctors and patients raise the alarm about long wait times across the province. The CBC's Sam Sampson is in Edmonton following this for us. And Sam, what more have we learned about the circumstances behind the 44-year-old man's death?
Well, we know that the father of three died after waiting for what his family says was about 8 hours after he presented to a South Edmonton emergency department with chest pains. His family says that he died of cardiac arrest. And we also know that there was a preliminary review of what happened. The family was so upset. They were saying that things could have been better. So there was a preliminary review just to see. And after that, the Minister of Hospitals and Surgical Health Services here in Alberta said, look, I still have more questions. I have more concerns about what happened. And so he is now asking and has been approved for a public fatality inquiry. And so essentially what that is it goes to court, and the goal is to try to know exactly what happened, what contributed, if anything, to this man's death, and also ultimately try to get recommendations to make sure this does not happen to anybody ever again. Here's what the minister said.
Well, there is no doubt that pressures in the system, and specifically at the Grey Nuns Emergency Department, on December 22nd impacted care. After reviewing the information available to me, with advice from clinical experts, I have concerns and unanswered questions about the circumstances surrounding Mr. Sreekumar's death. While system-level improvements are underway, a detailed, independent, and public review of how the specific case was managed also needs to be undertaken. We owe that to his family and to all Albertans.
Now, just when this inquiry will happen, we don't know. Sometimes these inquiries happen months or even years after the actual incident takes place.
Sam, what else is the province saying about overcrowding?
Well, they noted a lot of things that we already knew they were doing. So, for example, trying to speed up discharges, getting patients who could go home faster. They were also trying to get patients out of emergency departments who don't necessarily have to be there any longer. So think patients who could be treated and helped at care homes or even rehab facilities. They're trying to move those patients out. They're also, which is something new here, going to add a doctor in some Alberta waiting rooms. And so they're calling it the triage liaison physician role. Essentially, these doctors are going to be working with the triage nurses to try and speed up assessments of people who go to the emergency departments when you're in the waiting room. And even for some patients who might need healthcare faster, doctors could be treating you right there in the waiting room. So they're going to be starting that in 3 Edmonton hospitals and 1 Calgary hospital. We also know that the province focused a lot on the respiratory virus and illness patients that they say caused this surge that we saw over the past couple of months, so cold and flu patients. And they were saying that peak has happened, and hopefully there will be less pressure on the system. We will still be feeling that for a little bit, but because that peak has already happened, they're hoping that things can calm down a little. Now, a lot of this work might satisfy some of the physicians who have rang the alarm bells, even called for a state of emergency for hospitals here in Alberta, but some of the work might not satisfy them. Even earlier this week, we had an open letter we saw from 300 physicians who described the pressure that they and patients are seeing in hospitals. And they said root causes could be addressed, including adding more integration and coordination that these doctors say was lost after Alberta restructured its healthcare system.
Sam, thank you. That is the CBC's Sam Sampson, live in Edmonton.